So at what point do I realize I have breast? Not me, nobody. Amen. But at what point do you realize that, okay, now I have breast cancer? What kind of changes do you see in your breast?
I always say that you should know your breast. That's the most important thing. Like when I tap you, Bella, and I say, describe your breast to me. If you are sleeping at 2 a.m., you should be able to tell me the shape and size of your breast. 2 a.m.,
I'll fight you back. Why are you waking me up to describe my breast?
You should be able to tell me the shape and size of your breast.
Yeah.
Mostly one breast is bigger than the other. It's more common in the left. Mostly the left breast is slightly bigger. I mean, that's generally. But some people have their rights being bigger. Then the nipple, you ask yourself, is your nipple everted? So is it out? Is it flat? Or is it inverted? Mostly when it's inverted, there's a problem. But most people are either everted or flat. So let's say you have everted nipples. That means your nipples point out. And then you wake up one day and then it's pointing in. Should tell you that there's a problem. So you check your nipple, there should be no discharge. Every once in a while, you can have a little whitish discharge. It's not bloody. It doesn't smell. There's no odor. And it's mostly associated with your menstrual cycle and the changes.
Are you abnormal if you've never experienced that?
No.
Okay.
For some people, yes, that's what it is. But then if it's a lot and it's persistent, then you need to come for us to check it out. So these are some of the things you should know about yourself. Around the times you have these symptoms and signs, then you check the skin of your breast. Mostly the skin of your breast is smooth. But you start to notice that there's certain redness around the skin. There's something like an ulceration or a rash. I'm not saying every rash is breast cancer, please.
Yeah.
Yes. Or you notice that there's puckering or what we call peau d'orange. Your skin becomes just like the peel of an orange.
Okay.
You know how the peel of an orange is? No, it's something to report. So I say that the most important thing, know your breast. As soon as there's a change, please let us know. Because some people, the lump is like the last thing they find out, and that's the later stages. So as soon as there's a change, please let us know. And also the men and the partners, most of the time they have helped us diagnose breast cancer because of the lumps, because they can feel the changes. So please, I'm not encouraging very bad behavior, but then with your partner, you can do that for us and help us know when that changes.
If you're married. Don't say Dr. Hannah Lisa says with your partner, so you must get a boyfriend at all costs, even when you are not of age. So they remove your breast?
Yes.
One?
Yeah. What I say is just packaging, no, Bella.
What?
Yeah, I'm living with one breast.
Wow. I was hoping you wouldn't tell me that they had to remove the whole breast.
I had the whole breast.
And that was after chemo?
After the chemo.
Doc, at what point does your breast have to be taken off completely?
Okay, so it depends on the size of the cancer, whether or not it has spread to other parts of the body. So if it's small, we'll have a lumpectomy. So a lumpectomy is just removing the lump. So it means that it hasn't spread beyond its confined tissue. So we can just remove the lump. But doctors just want to be sure. So then we may do radiotherapy or chemotherapy. So that if there's just a little that has escaped somewhere, we kill it. Yes. Then there's the mastectomy. That's removing the breast. So the mastectomy, either we're removing one breast or we are removing both, depending on how far it has spread. May go with either chemotherapy or radiotherapy. Chemotherapy is using drugs. The drugs can be IV drugs or pills or tablets to either kill some of the cells to reduce the size before surgery. That's neoadjuvant chemotherapy. Or kill the cells after surgery, which is the adjuvant therapy. So these are the options available. Radiotherapy is using radiation to kill. Then sometimes if it has spread to your lymph nodes, that's why sometimes when we're doing the exam, we check the armpits. The lymph nodes are there. Then they can also remove the lymph nodes as well. Now there's an option of reconstruction. So that depends on how bad it is. Based on the surgeon's evaluation and then the oncologist's reports, they'll be able to tell you if that option is available to you. Then we also have something that is not common in Africa, but it's common elsewhere, is the prophylactic mastectomy.
What's that?
So most of the time you realize that somebody's grandmother died of breast cancer. The mother had breast cancer. Your sister has had breast cancer. I am not a prophet of doom. Who is next? It's you. So if you realize that you are next and you want to do something about it, you won't wait for a diagnosis of breast cancer to be made. You just go to the hospital and ask them, please, take out all my breast tissue.
So you become
it's
flat-chested.
Not flat-chested. So that is where there's a beautiful reconstruction for you. They've taken out all the tissue. They fixed it with silicone, other things. So it's there. So you're walking around. Nobody knows that it's not your breast tissue that is in there.
So is it true then that silicone prevents breast cancer?
If you do prophylactic mastectomy, that means that you've taken out the tissue. No breast cell can even abnormally grow to become cancerous.